Good morning, everyone. It's Dr. Hodges. I'm out for a little quick morning walk. I will tell you, part of the reason why I haven't had a lot of new videos is I've been really bad about walking. And this is usually whenever I will make my videos. I feel like it's one of the only times I have time to myself. And so, because when I'm at the house, I have 8 million other things that are distracting me. But this is the one time whenever I can sit down, or stand up and walk, I guess, and make some videos for y'all. So what I would like to talk about today is, well, it's springtime. The flowers are blooming. What can I do with all these allergies and my asthma and all this, because I've had bariatric surgery and my doctor said I can't take steroids. So what all does this mean? So what are some medications that you are not allowed to take after you've had surgery, and then what are some of the things you can do about it? So the two main things after you've had weight loss surgery that you cannot have, and this is forever and ever amen, are going to be NSAIDs and steroids. Now, what is so wrong with these? There's nothing inherently wrong with them. It's just that what they do is they decrease that protective mucosal layer in your stomach wall, and so it predisposes you to developing an ulcer. And if you have had surgery, the prime place for that ulcer to pop up is going to be right at your anastomosis, or right along the staple line. Anastomosis just means hookup. So if you had a bypass or duodenal switch, you're going to have an ulcer between the stomach and small bowel, where I've hooked those up with the little staple line. And the reason why is, for every anytime that you have a cut or an incision or scar, it's only going to heal to about 80% of its original strength. And so if you're going to have an ulcer, it's probably going to be at a point of weakness. It's going to be right at that staple line. So what is an NSAID? An NSAID is ibuprofen, Aleve, naproxen, naproxen, ibuprofen, did I say Advil, Motrin? Yeah. All the good stuff. The stuff for aching joints. Like, let's say you are a patient and you have bad knees. You cannot take your Aleve on a daily basis. You will get an ulcer. I usually don't even like you to do Celebrex either, even though that's technically what we call a COX-2. So it's like aspirin. You still can develop a little bit of ulceration in your stomach. And so ideally what I just have you do is Tylenol, which is also called acetaminophen. That's the same thing. If you have allergies, you could do any allergy medicine. So you can do Zyzol, which I've been living off of, Sudafed, Claritin, any one of those, totally fine. The other thing is, oh, I need to cross the street and it's a little busy this morning. You can do any one of those allergy medicines. If you have asthma, you can take your asthma medicine, you can take your asthma inhaler. And the reason why is, in those asthma inhalers, sometimes there's a little inhaled steroid, but those steroids stay in your chest. And so just like an NSAID, oral steroids, so like prednisone or like a hydrocortisone shot, a prednisone pack or a Medrol dose pack, that's all the same thing. Those are going to be systemic, meaning they go out throughout your body. Those also act like an NSAID in that they decrease that mucosal barrier that protects your stomach from developing an ulcer. So it's really important that if your doctor, it's like allergy season time, if you need a prednisone pack, you need to give the office a call. And it doesn't matter if you're 8 years out from surgery, because you can still develop an ulcer. So what are the exceptions to the rule? Honestly, if you just need to take your ibuprofen once in a blue moon, like maybe you have really bad menstrual cramps and the worst is like the first day and the only thing that seems to help is your ibuprofen, take your ibuprofen. You can take that. Because if you're just doing it like once a month or like 2 or 3 times a month, that's not going to give you an ulcer. But if you're doing it several times a day, several times a week, you will absolutely develop an ulcer. Let's say you're an ortho patient and you need an injection in your hip or in your neck or in your shoulder or somewhere in one of the joint spaces. That steroid actually stays in place. It's not systemic, so you can have that. That's the same with my asthma patients. So if, let's say you're having chest issues and you need an inhaled steroid or you need a nebulizer treatment, totally fine. Oh my gosh, I've got to show you all this. This is what I'm talking about. These allergies are so bad. I was gonna make another video and then my face started itching. So look at this. Do you see all that junk? That would all be the, what's that called? All the pollen that's making my head feel like a big balloon. So literally I've been living off of Sudafed and Zyzal. Although I love flowers. I just don't like their pollen. So if you, so you're an ortho patient, you can do any injections, that's totally fine. You can also do your inhaled nebulizer treatments. That's not gonna hurt a thing. If you have achy joints, one thing that you can get that's an NSAID, and you can use it every day, is there's a cream called Voltaren cream. It's now, you can get it over the counter. Somebody asked me how much it was. I don't know how much it is. I think it's 15 bucks, maybe 20, something like that for a tube. And so like, let's say you have an achy knee, you can put a little dollop on your fingers and rub it in. The bioavailability, meaning how much it goes throughout the body, is really, really low. I think it's like 1/12. So it's just basically gonna stay put right there on whatever area that you're rubbing it into. So even though I don't want you doing ibuprofen every day, you could use some of that Voltaren cream, slap that on. The other thing could be that maybe there are other joint things that are going on that your ortho doctor needs to take care of for you. And definitely, if you've had weight loss surgery, the idea is if you can get some of that weight off, it's certainly going to take off stress off your joints, and so they should start to feel better. So this was a little quick reminder of medicines not to take. Forever and ever, amen. And of course, if you ever have any questions, just feel to give the office a holler. Okay, y'all take care. Take your Claritin.